Hi, I'm Dr. Lisa Goins, nurse practitioner with Couture Health Care, and we're talking about BMI. BMI means body mass index. To figure your body mass index, we need two measurements, okay? The first measurement is, how tall are you? Are you 6 foot tall or are you 4 foot tall or less, okay? Now we have that one. We can also translate that into foot, into centimeters or inches, okay? And it's important to how you wish to do that. Then we're going, and keep that number in mind, we're going to go to the next second number, and that is your weight. So are you 100 pounds, 150, 200, 400? How much do you weigh? Now you're going to take those two numbers and then you're going to pull up a BMI chart. Now you can pull up a BMI chart off of Google. Google is very helpful with those kind of things, and you can look to see what your height and your weight is. Now if you're in your provider's office, that will be calculated when they put in the vital signs into their electronic records, and they can tell you this is what your BMI is. Okay, so what does that mean? What do I do with those numbers? BMI is one way for us to discern, based on your height and weight, because everybody comes in different shapes and sizes, are you within your range as far as do you have enough body mass or do you not, okay? So if you're too skinny, then your BMI mass will come into under 18, right? So that means you're too skinny. If you're too skinny, well, you know, I look great in my fashion. Well, you may not be able to walk the runway if you're too skinny. Okay, so they've changed the rules on that. And one cracker is 45 calories, all right? So there is some calories in that cracker. Now, the problem is if you get sick and you go to the hospital and you're too skinny, your body is fighting two wars, one to make you better and one to keep the weight on your body. This can extend your hospital stay, and this can cost you a lot more money, okay? So we don't want to be too skinny. The next range is the Goldilocks range. This is the right height to the right weight. You're in the perfect zone. The problem with this area is a lot of people believe the Photoshop pictures they see, and they believe a lot of the advertisement that they're not in the right body weight. Parents may even tell their children, you're fat, when they're perfectly in the right size, okay? So you got to be careful about that. The images and the perception of what you're seeing is not always a reality sometimes. So take a picture, take a look at things, compare the body weight, and if you're where you're supposed to be, you should be proud of that, okay? Now, this is where we go into the next category, and this is overweight. What is a true overweight? Now, technically, an overweight is 24, 25 range, definitely 25 if you're really going to push it. But if you're in that 25 and over to 30, that's overweight on the BMI. Okay, so that means that you've got to lose some weight. Now, what does this mean as far as sizes go? Well, it takes anywhere between 5 to 20 pounds to lose a size depending on a fashion designer. Not all sizes are the same. There is a standard size for America, and there are standard sizes for European and the fashion clothing lines and things like that. But if you have enough money and you want to be a size 4 and you are really big, the fashion designer will make you a size 4. So don't fall for that. You're not a size 4, you're probably 24, okay? But they're going to take your money and put you in a size 4. All right, they will change that label out. They have said that. So do be careful about those things. Just because you squeezed into a Walmart 12 does not mean you're a Walmart 12. You could be actually a little bigger or a little less. Okay, so do be careful with that. Heads up to Walmart, sorry about that. And then the next area is overweight. This is obvious. You look in the mirror and there's not enough mirror. There's a problem here. You need to lose weight. So unfortunately, we call that obese. Then, if you go beyond that, it's morbid obese. This means you're going to die because you're too fat, all right? Plain and simple, we're trying to be nice with it, we're trying to sugarcoat it, but you're going to die because you're too fat, okay? So, we're kind of concerned. So these are just ranges that we try to categorize people. Now, the other thing is, a BMI is not perfect. So if you are in really good health and you're an athlete or a bodybuilder, You're going to be heavy, so we're going to be looking at an actual third measurement of actually measuring the actual body fat on your body to discern what your percentage is. Is it 3%, 12%, and so forth, to what you're really weighing. For the average person, a BMI works perfectly fine into discerning if you've lost weight or not. Okay? So that is what a BMI means, and if you have any questions, you can please message us. This is Couture Health Care, and I'm Dr. Lisa Goins, and we're going to couture your health with your BMI. Thank you for watching.